Should TB patients be isolated against their will? Imagine a situation where someone has a contagious disease that can spread through the air. In the case of tuberculosis, especially when it's active and infectious, public health measures often call for isolation to protect others. But should this be done against the patient's wishes? Let's explore this important question with facts grounded in science and public health principles. The main goal of isolating tuberculosis patients is to prevent the bacteria from spreading to others. Tuberculosis bacteria can be transmitted when someone with active pulmonary tuberculosis coughs, sneezes, or even talks, releasing tiny airborne droplets. These droplets can stay in the air and infect people nearby, especially in crowded or enclosed spaces. To reduce this risk, healthcare facilities use special rooms called airborne isolation rooms. These rooms have negative pressure ventilation systems that prevent contaminated air from escaping into other parts of the building. Isolation is usually recommended until the patient is no longer infectious. This is determined by clinical improvement and laboratory tests, such as negative sputum smears or cultures taken over a period of time. Typically, patients are considered non-infectious after several weeks of effective treatment, which kills the bacteria and reduces the risk of transmission. The exact duration depends on the patient's response to therapy and microbiological results. Legal frameworks in many countries give public health authorities the authority to impose isolation measures when necessary. These laws are designed to protect the community, especially when voluntary compliance is not enough. However, ethical considerations are equally important. Respecting individual rights and dignity is a core principle. Therefore, isolation should only be used when there is clear evidence that the patient is infectious and poses a significant risk to others. Before resorting to involuntary isolation, health professionals usually try to encourage voluntary compliance. They may provide education about the importance of treatment and isolation, along with social support to help patients adhere to therapy. Directly observed therapy, where healthcare workers supervise medication intake, is often used to ensure patients follow their treatment plans without needing forced measures. In healthcare settings, strict environmental controls are standard. Negative pressure rooms, high-efficiency particulate air filters, and proper ventilation help contain the bacteria and protect staff and other patients. These measures are part of routine infection control and are crucial in preventing outbreaks, especially of drug-resistant tuberculosis strains, which are more difficult to treat. The decision to isolate against a patient's will is not taken lightly. It must be based on scientific evidence of infectiousness, be proportionate to the risk, and be implemented with respect for the patient's dignity. The duration should be as short as possible, and patients should receive medical care, clear communication, and support throughout the process. In summary, isolating infectious tuberculosis patients, even against their will, can be justified from a public health perspective when the risk of transmission is high and voluntary measures have failed. Such measures are guided by strict criteria, legal authority, and ethical principles. The goal is to protect the community while respecting individual rights as much as possible. Always remember, medical decisions should be personalized, and patients are encouraged to work closely with healthcare professionals to ensure safe and effective treatment. For anyone facing tuberculosis, consulting qualified health providers is essential to understand the best course of action based on their specific situation.